Yeah, thanks for joining us. This is a news programme with Dr. Neil McGarvey from Strathclyde University. How you doing, Neil?
How you doing, Paul?
And Tom Clayton, he is a fellow colleague of mine at Radio News Hub, who is a broadcast journalist. You okay, Tom?
Yeah, very well, thanks, Paul. How are you?
Yeah, good, thanks. So, yeah, we're just going to sort of talk about the UK government's coronavirus response, and we'll follow that up with how the devolved nations have responded individually, easing in terms of easing the lockdown, how things have sort of progressed and where we're at now. And then we'll finish off the programme with how Donald Trump has handled the unrest in America and how his messaging has been accepted by the American people. So, yeah, just to begin with, Neil, I'll start with yourself. Obviously, we saw the other day Boris Johnson saying in the House of Commons that he was proud of the UK's coronavirus response, but the latest national records of statistics indicates that we have 50,000 deaths, and that a lot of people, a lot of scientists are quite wary of the fact that we're easing lockdown so soon with such a high death rate. And of course, the UK was one of the sort of leading nations in the world, most developed countries to slowly respond to the pandemic. So how would you sum up the UK government's approach to tackling coronavirus?
Sure. Well, I think initially we could speak of a sort of UK-wide approach because there wasn't a great deal of significant difference between the devolved nations in terms of going in, so everyone sort of went into lockdown together. But what was noticeable was that the government was almost following sort of institutions like employers, universities, colleges, schools were locking down before they were ordered to by the government. So I think there's a broad consensus that the UK government went into lockdown too late. It was too liberal in its approach. I think you'll find few commentators disagreeing with that in terms of the sort of early to mid-March sort of lockdown and it taking so long. I think it was the 23rd of March before the whole country went into lockdown. Yeah. So I think there's a broad consensus on that. But I mean, it was notable at the time that Northern Ireland, Wales, and Scotland and England were all sort of in sync at that point. It was very, very apparent in Ireland. Obviously, it's St Patrick's Day. The bars and clubs in Northern Ireland were open, but the bars and clubs over the border in the south were not. So that was very noticeable, and that was the 17th of March. So I think the lockdown came in, the week after that.
Yeah, and Tom, as Neil was saying there, he was talking about the lockdown wasn't as strict as it could have been, as opposed to countries like Italy and Spain. And you could argue that they've sort of the reward is paid off with Spain's recorded no new deaths for 2 straight days, and Italy sort of getting back to a new normal with a lot of restrictions being eased, and they're starting to sort of go about their daily lives. So do you think the UK could have taken a more stricter approach in the lockdown?
I think they absolutely could. The first recorded case of coronavirus in the UK came on the 31st of January. By the end of February, we had nearly 1,000 people tested. Well, I think almost over 10,000 people tested, and quite a few of those had been diagnosed with the virus. I would even look as further afield as New Zealand in terms of what we could have done, or what the UK government could have done in terms of locking down. As soon as they had a case, not even a death, a case, they went into full lockdown. The whole country was, everything was closed, everyone was indoors, and they're now, I don't think they have a single case in hospital of coronavirus now. So had we followed that approach, I think we would have been out sooner. I think the difficult thing that the government face is that, British people are very kind of stubborn and they don't like to be told what to do. So it's always going to be difficult to implement a full lockdown. So I think the lockdown measures that were put in place were as good as we could have got at the time.
Yeah, I was actually talking about New Zealand. I was on Professor Carol Sikora's Twitter recently, and he was basically saying that New Zealand and the UK aren't too different in terms that they're both islands, so it could have been a lot easier to contain something like coronavirus in the UK, just because of its sort of situation in the world. How it is an island, and we're not as isolated as New Zealand, but yeah, we could have definitely have taken an extra precaution like New Zealand did. I'm just going to sort of play a clip from Boris Johnson. This was dated back from the 3rd of March, and he sort of just says how ready the UK government is and his cabinet minister is ready to tackle coronavirus. He also talks about in it how they'll do everything they can to sort of make sure the country doesn't fall into a sort of crisis. So this is Boris Johnson, the 3rd of March, and then I'll get your thoughts on it.
Our plan means we're committed to doing everything possible, based on the advice of our world-leading scientific experts, to prepare for all eventualities. And let's not forget, we already have a fantastic NHS, fantastic testing systems, and fantastic surveillance of the spread of the disease. We will make sure the NHS gets all the support it needs to continue their brilliant response to the virus so far. The plan does not set out what the government will do. It sets out the steps that we could take at the right time and on the basis of the scientific advice. Our country remains extremely well prepared, as it has been since the outbreak began in Wuhan several months ago.
Yeah, so there's 2 points that I'd like to highlight there. One is testing, and the second is at the end he says about preparedness. So in terms of testing, Neil, obviously he's basically saying there at the start of March we have a great testing capacity and system that will be able to be implemented. But if you go forward a month into the end of April, that's when we started only like testing vigorously, and the World Health Organization have said, since they declared it a global pandemic at the end of January, that testing is the way to defeat coronavirus. So can you argue that testing is the sort of factor that has affected us the most, as opposed to a strict lockdown or too late of a lockdown?
Well, I think it's undoubtedly both, but I mean, the World Health Organization was obviously prescribing a testing regime, and I'm pretty sure Germany continued to follow that advice, whilst the UK abandoned the sort of testing regime that they'd put in place, and basically have been working it up ever since. And I think even today, I mean, I don't think many would independently describe the current testing regime as fantastic, as Boris Johnson did on the 3rd of March. So, and even in testing, you're actually getting a sort of, well, I mean, it's much the same system, but I'm pretty sure the branding of the testing in Scotland and perhaps Wales and Northern Ireland is different from England, so that there's slight differences emerging across the UK. But I think again, that undoubtedly, I suspect, when it comes to, if there is an independent inquiry into what happened, I mean, I think a lot of questions will be asked about the approach to testing, and the difference between the UK approach and the approach of countries like Germany, as well as New Zealand and many other countries throughout the world.
Yeah, and Tom, as I was talking about there about preparedness, well, actually something just got released from the Scottish Government today. It was a report that they published, basically just said that the Scottish Government had carried out a sort of simulator test back in March 2018, where it showed that they failed basically to prove that it was capable of dealing with an outbreak of a respiratory illness, and basically saying they wouldn't be able to deal with a pandemic. And I think that sort of obviously stems from the UK as a whole. You could argue that they weren't fully prepared enough for a pandemic, as opposed to countries in Asia that have had outbreaks of SARS. So basically what I'm just asking you is that, do you think we were prepared or not prepared?
I think it's difficult to say whether we were prepared or not, because in this situation, it's something that no one has ever really dealt with before, particularly in Europe, like you say. Asia, they've certainly not had an advantage or anything, but, they've dealt with situations like SARS before and things like that. And I don't think anyone could have been prepared to see the scale of the outbreak that we have seen. Thousands and thousands of people. They think it's over 50,000 people have tested positive for the virus now, which is a good chunk of population. A couple hundred, maybe a couple of thousand would have been noticeable, but 50,000 is an awful lot. In terms of preparedness and testing, I think the UK does have a fantastic testing facility. I think the NHS is one of the best health services in the world. As much as people have their opinions that it's underfunded and understaffed and overworked staff and everything, I think that the facility they have to test is very good. But I think the Westminster government certainly shot themselves in the foot a little bit when they said at the start of the pandemic, at the start of lockdown, we're going to be testing 100,000 people a day. That's a very bold target to meet, and I think they kind of proved that it took several weeks to get there. I think they are testing over that number every day now as well. The difficult thing was at the start, I don't think they were quite prepared to meet on the promises that they did give immediately.
Yeah, and just moving on, we'll sort of talk about during the lockdown. We obviously saw a few instances of a couple of the chief scientists, part of the UK government. We also saw Dominic Cummings, Boris Johnson's senior advisor, and Dr. Catherine Calderwood, Scotland's chief medical officer, that they all breached lockdown in some way or another. And it was quite interesting to see the way it was handled between the two countries. So obviously in Scotland, we saw when it emerged that Calderwood had broken lockdown. She went to her second home in Fife twice, admitted to that, and was completely sorry. She apologised to the press and the public, and then gave her resignation. But whereas we see in England, when obviously there were two different cases, Dominic Cummings obviously said it was to do with his children, and Catherine Calderwood was more of a sort of luxury event. But it was interesting just the way, obviously, Boris Johnson had his backing. Dominic Cummings said he had no regrets. So just to sort of refresh your memories, I will introduce how Scotland dealt with it and through audio. So I'm just going to play Nicola Sturgeon when she was talking about Catherine Calderwood.
Chief medical officer made a mistake in travelling away from her home. Whatever her reasons for doing so, she was wrong, and she knows that. It was not in line with the advice we are asking everyone to follow. She has apologised unreservedly to me and to the public, and she's right to have done so.
And then this was Catherine Calderwood's response after Sturgeon sort of introduced that press conference, saying what she had to say on the issue.
As well as this weekend, it's important to be clear that I also was there last weekend with my husband. I did not follow the advice I'm giving to others. I'm truly sorry for that.
So yeah, Neil, you can see from there that obviously the Scottish government right away, and Catherine Calderwood herself, just put their hands up and admitted that's something that shouldn't have been going on when they've asked the rest of the country to obey lockdown rules.
Yeah, well, I mean, I think a lot of this is about trust and confidence in government. And during a crisis that we've got right now, it's very important that that sort of trust and confidence is maintained, because essentially the Scottish, the UK government, Welsh, Northern Ireland, they're asking individuals to do things they would not otherwise normally do, and in order to get compliance for them to do that, it's important that they have trust and confidence that government is giving them the right message, that it's medically backed, and importantly that they are following the same advice they're giving the rest of the population. And that essentially explains, I mean, to be fair, Neil Ferguson down south, he resigned after had been exposed in newspapers. Calderwood resigned, and obviously the contrast with Dominic Cummings is quite marked, in that there was obviously no resignation, not even an offer of a resignation, according to his own press conference. So, I mean, I think it's very apparent and very clear that is a significant factor in. I mean, I think weekend polls were showing that there was a massive sort of, or a very significant coming down of the confidence in Boris Johnson and the ratings in terms of competence as a Prime Minister. And I think that sort of, those events alone probably go a long way to explaining that.
Yeah, and Tom, I'll bring you in. I'm just going to play Dominic Cummings, how he sort of responded to the accusations of what he did during lockdown.
No, I don't regret what I did. As I said, I think reasonable people may well disagree about how I thought about what to do in these circumstances, but I think that what I did was actually reasonable in these circumstances. In terms of the rules, I think that the rules made clear that if you're dealing with small children, then that can be exceptional circumstances. And I think that the situation that I was in was exceptional circumstances. And I think that the way that I dealt with it was the least risk to everybody concerned if my wife and I had both been unable to look after our 4-year-old.
And then just before I ask you a question, Tom, this was Boris Johnson sort of handling it to the press, where after Dominic Cummings had made his press conference.
I'm, of course, I can't give any unconditional backing to anybody, but I do not believe that anybody in Number 10 has done anything to undermine our messaging. What we want to make absolutely clear to the public is that the only way to solve this problem is if we stay alert, follow the guidelines, control the virus, and save lives. And that has been immensely effective so far.
So yeah, Tom, basically just how do you think that sort of situation was handled? It was quite different to what happened in Scotland, because Dominic Cummings sort of did use a loophole where he was talking about that it was for the benefit of his children and his family's health. So obviously it was quite a bit of you could argue it was a difficult decision for Boris Johnson having to sack someone when they say that it is for their kids. What's your sort of interpretation on it?
My interpretation of what happened with Dominic Cummings, rightly so, he exploited a loophole, which I think if anyone kind of knew that loophole was in place, they would try and play it off as a loophole that they would exploit as well. The difficult thing was, had it been, say, for example, had he gone from London to Birmingham or London to a closer location, it may have been more reasonable. It's the fact that he drove across a majority of the country that there's been so much of an outcry. I mean, even he said that reasonable people will disagree with what he did. So he is, I won't say that he's admitting that he knows he's wrong, but I think he understands that he had to defend himself to retain his job. And I think Boris Johnson has a lot of trust in Mr. Cummings. He has a lot of faith in what he says. So he kind of has to support him really in that sense. Otherwise, he forces himself into a difficult situation in Number 10. When you look at the contrast, though, on the other side of the House of Commons, Rosie Duffield, who's the MP for Canterbury, she resigned after she broke lockdown rules. She admitted that she went out to try and fix a relationship. She went to meet one of her exes to try and fix that relationship, and she's resigned from her position on the front bench of Labour. So the difficult thing is, at what point do you call it a double standard? At what point do you discuss what should have happened and how it should have been handled, and where do you draw the line for who should resign and who shouldn't? You would have thought that if one of the Tory front benches, if that happened on the basis of principle, they would have resigned as well. So the question really is, why wasn't there an inquest into what happened with Mr. Cummings, and why wasn't it handled in the way that Labour handled, not necessarily the way that Labour handled it, but the way that Mrs. Duffield handled things and resigned pretty much immediately from it as well.
Yeah, just sort of moving on onto the exit strategy from the UK and the four nations themselves. So obviously we saw England take a different approach to Wales, Scotland and Northern Ireland. Boris Johnson announced measures near enough the start of May, and then Scotland and Wales 2-3 weeks later Northern Ireland sort of set out their vision. So this was Boris Johnson, just a sort of clip of when he did introduce the lockdown being eased. And I'll just follow up with a couple of questions after I play it.
We said that you should work from home if you can and only go to work if you must. We now need to stress that anyone who can't work from home, for instance, those in construction or manufacturing, should be actively encouraged to go to work. And from this Wednesday, we want to encourage people to take more and even unlimited amounts of outdoor exercise. You can sit in the sun in your local park, you can drive to other destinations, you can even play sports, only with members of your own household.
Now, Neil, the day after that, I spoke to a couple of MPs, Daniel Zeisner from Cambridge, and we obviously heard Keir Starmer as well. They were quite critical of the messaging, the way it sort of came across, and it sort of left the public in a bit of limbo. They weren't too sure what exactly Boris Johnson was asking of them. How do you think that his sort of, if you take yourself back to that time, how was it from your point of view, the sort of speech that he delivered to the easing of lockdown?
Sure, I think again the clarity of the messaging, particularly that conference. I think that press conference in particular got a lot of criticism at the time because a lot of people were quite confused about what the new rules were going to be and what they were. And in the UK, you've got the added complication that different parts of the UK are not following the same stages as England. So a lot of that messaging applies only to England, and that's not always made clear in those types of press conferences. So the Scottish, the Welsh and the Northern Irish governments have been doing different things. So I think that the clarity of messaging, particularly from Boris Johnson himself, has probably been the most important or one of the most sort of fundamental criticisms of his leadership during this crisis. And even the sense of, is he in control because of what happened with Cummings, because he's followed, well, the UK cabinet have sort of do the briefings, the daily briefings as a sort of team, whereas the approach in Scotland is that Sturgeon is there every single day, and doing the press conference on their own, whereas you might only see Boris Johnson a couple of times a week. So there's a lot of issues that's thrown up. But I think in terms of clarity of messaging, it was very, very poor at the time.
Yeah, and I'm just going to come to you again, Neil. Why do you think that the other three nations? Well, why actually was it the other three nations didn't follow England and Boris Johnson's approach?
I think. Well, they will say it's they're following. Politicians since the COVID crisis, the mantra has been we're following the science. But in a sense, politicians make the big political decisions, not scientists. They interpret the scientists, and it's up to them to make the decisions. So, and I suspect that there is a bit of distancing going on, in that it's because of the widespread interpretation that Johnson is not leading this crisis in a particularly effective manner. The devolved administrations are seeking in some way to distance themselves from that and pursuing their own particular lockdown strategies or exit strategies, or call them what you like. So I think there's a bit of both going on. In Northern Ireland, you've got the fundamental thing is, in terms of geography, they're an island, and if they're doing things differently from the rest of Ireland, it does look pretty bonkers, and in the context that there's not actually a border there physically, so people could come and go in the rest of the island.
Yeah, and Tom, I'm just going to play you Nicola Sturgeon's clip, and then we can sort of compare her sort of delivery to Boris Johnson's, of how clear it is what she's actually asking of us.
I'm sure that everyone watching will want to know what changes will be made as we move to phase one. But first, a word of caution. Not every phase one measure will necessarily be introduced immediately on the 28th of May. Some may be introduced a few days after that. And depending on the evidence, it is possible that some may have to be postponed, though I very much hope that won't be the case.
Yeah, so Tom, just as obviously that's Nicola Sturgeon addressing Scotland on a different sort of scale to the way England was addressed by Boris Johnson. So as someone that comes from England, listening to the two leaders sort of giving out their vision and their guidance, what do you think is a sort of more clear one when you're hearing the two?
I mean, you look towards Nicola Sturgeon's delivery first and foremost, just because she says from the outset, look, we're going to introduce this new phase of coming out of the lockdown, but just be aware, it might not all happen at once. Some things might not happen at all. We may have to go back to where we are. Boris Johnson's kind of contrast to that is, we said this in the first place. It actually meant this. And, by contrast now, we're going to bring these things in, whatever the situation. If this so-called R comes back up, then, we may go back down. But it's very much a contrasting kind of answer as to what he means. And I think it throws quite a lot of confusion, which, at which point I do actually feel quite a lot of sympathy for people living in Scotland, Northern Ireland, Wales, because they're having to listen to the Westminster government and listen to guidelines there, and then also listen to their own government and interpret what it all actually means for them. In England, it's fairly straightforward. We have one kind of government that just kind of tells us what to do, and that's it. And in Scotland, Northern Ireland, and Wales, it's a completely different animal. So for me, I would be more inclined to listen to the local governments, especially when Nicola Sturgeon's a lot more clear like that.
Yeah, and just sort of rounding off things, we've got a few minutes left. We'll talk about what's going on in the US following the death of George Floyd. And we can talk about, from your sort of political expertise, Neil, about just how the way you think Trump has handled that. So I'll play a clip of about a few days into the unrest. And he's obviously quite concerned, and I imagine quite a lot of civilians are there as well with a lot of stuff that's going on. So this is what Trump basically threatened the country with.
The following measures are going into effect immediately. First, we are ending the riots and lawlessness that has spread throughout our country. We will end it now. Today, I have strongly recommended to every governor to deploy the National Guard in sufficient numbers that we dominate the streets. If a city or state refuses to take the actions that are necessary to defend the life and property of their residents, then I will deploy the United States military and quickly solve the problem for them.
Now, Neil, this was quite obviously a hard-hitting bit of news at the time, obviously threatening civilians with the US military. Is that really the right thing to do when the country's quite divided? What's your sort of take on that?
Yeah, I mean, I think like many others, Trump is by no means an inclusive president in the sense that he's not a president, probably unlike virtually all of his predecessors that has even sought to be that type of inclusive. And a lot of the rhetoric is very us and them. That it's law and order. The thing is, Donald Trump will never stop looking to that November election, because every action that he takes, every bit of rhetoric at the moment is, essentially America is in campaign mode, but it's a very, very unconventional campaign that's going on. And it could be a very long, hot summer in the cities of America, given current events and the way that they're being responded to, and the sustainability of that. We're getting a lot. I think we had some symbolic shows of the army in Washington D.C., but the Constitution of America and states means that governors in the states would have to call for the National Guard, and there's a lot of, the division of powers. Often something that the rhetoric of Donald Trump doesn't acknowledge in any way, and that perhaps there's a significant proportion of the American electorate that are not aware of the mechanics of the US Constitution. And it's been pretty clear that Donald Trump is willing to sort of ride roughshod over many aspects of what are sort of conventional sort of political understandings in the Constitution over there. But it looks as if it's going to be a pretty long summer over in America, and the whole Black Lives Matter movement. It's it's built up not only an American momentum but almost a global momentum. You know, you're seeing actions across the world as regards what's going on in America.
All right, guys, that's all we've got time for. That's the half-hour mark. So I appreciate you guys joining me, and take care. Thank you.
No worries. Take
Cheers,
care,
thank
Paul.
you.